Hello and welcome to Just Therapist Things, where we talk all things therapy. My name is Jordan and I'm a licensed marriage and family therapist from sunny California. I am the private practice owner of Vital Mind Therapy. I lead support groups at a cancer support nonprofit, and I am the new author of the children's book, Anxiety in My Body. Thanks for listening. Hi, everyone. It has been quite a minute, more than a minute. I know, a lot going on recently. I got married, went on my honeymoon, had a ton of friends' weddings, work, business, and all the things. I am unsure if I will be back to podcasting for real. We'll see how I feel. But I did want to come on here and do an episode about a topic that I was personally searching for on Spotify and for podcasts recently, and I could not find anything about this topic. So I thought, okay, why not make one myself? The episode today is on a psychology niche called medical family therapy. This is essentially a way for MFTs or other counseling degrees to specialize in family therapy within a medical context. Medical family therapists, or MedFTs, are trained with specific knowledge in how physical illness and medical challenges affect an individual and a family system. So you may be thinking, well, duh, of course people going through illness or physical health difficulties need mental health treatment. But you may be surprised to hear that this is a niche in the mental health field. It is really shocking how few people specialize in this and how avoidant or fearful some mental health professionals are to work with illness. It might be because it's sad or it's triggering to some, which I definitely understand. But I don't know. I mean, this is such important work. And personally, it's the kind of work that really fires me up and motivates me to be a therapist. And trust me, I agree that it shouldn't be such a specific niche in the mental health care field, considering that a 2015 report by Science Daily said that over 95% of the world's population has some form of a medical problem. So there you have it. This type of specialty is needed. Physical illness is not just physical, and the mind-body connection is so real. I have been thinking for a little bit that I want to transform my practice to be totally psycho-oncology, med family therapy focused, but we will see what the future holds. And I also like to think that medical family therapy is basically what I already do with my private practice and with my work at cancer support community, with working in both settings with people affected by cancer and chronic illness. But you do have to get a certification to call yourself a medical family therapist, or MedFT, which I also want to do once finances allow. So let's talk about the origins of medical family therapy. This approach started to develop in the 1970s as a response to a gap in the healthcare system of a lack of connection between physical and mental health. A gap that is getting smaller, but definitely still exists. Since the time I was a new grad student 6 years ago and had just discovered how passionate I was about the mind-body connection and the physical and mental health connection, I have been saying, wouldn't it be so awesome and help so many people if primary care clinics, hospitals, other medical clinics, medical professionals just in general had direct referrals to therapists who specialized in working with people who are going through physical illness. And this does exist with social workers in hospitals and clinics and such, which I will get into in a little bit. But I think that gap really needs to be smaller still. And so that's something that I'm trying to do with my private practice, is network with hospitals and medical professionals and things like that. And now that my husband is a doctor and in medical school, I'm like, all right, let's go. Let's do it. Medical family therapists use a biopsychosocial and systems-based approach while having a basic understanding of illness, the medical system, and medical-related trauma. The family systems approach recognizes that individual illness impacts the entire family system and explores family relationships, communication patterns, and emotional challenges that may be coming up or highlighted due to illness. The goal of this approach is to strengthen family resiliency in the face of illness. MedFT also has a huge focus on patient advocacy and patient autonomy, which is so important and so huge in the face of illness. MedFTs usually collaborate with healthcare providers, clinics, hospitals to provide holistic treatment for their clients. And MedFTs can work in private practice, hospitals, outpatient clinics, medical centers, etc. Many major hospitals have oncology or chronic illness support centers with oncology social workers or social workers with a medical specialization. And interestingly enough, I have not seen health clinics or hospitals that employ MFTs or MedFTs. It's really just all social workers from what I've seen. And that, again, it's probably a generalization, but from my research, mostly social workers. And I actually inquired about this through a UC hospital system that is close to me, because when I was in between jobs and beginning to start my private practice, I was like, oh, that would be cool to, maybe work at a hospital, be a patient navigator, work in the oncology support center, something like that. And this UC hospital actually said that they are just not credentialed to hire MFTs. They hope to be, but they're just not. They're only credentialed to hire social workers. And I definitely get that. I mean, social workers, they have specific training in casework, and there are specializations in social work related to working in hospitals and in medical systems. But MedFTs are a thing. MFTs who specialize in chronic illness, cancer, psycho-oncology is a thing. And so hopefully MFTs can be hired into these type of settings soon. There's actually one major cancer hospital in Southern California that recently started hiring MFTs in their oncology support center. And I've been communicating with someone who works there, and it seems like it's becoming a really great program. But they are really starting to see the importance of having a therapist who has a MedFT, MFT training and who understands how medical conditions affect individuals in addition to the entire family unit. Per my research, I have found 17 colleges or universities that provide training and certification for medical family therapy. So in the grand scheme of things, thinking about how many colleges and universities exist in the US, this is only in the US, by the way, 17 is really not that many. So this still is a very small niche. And you can get a postmaster's or postdoctoral certificate in medical family therapy. You can get a PhD in medical family therapy, or you can do an MFT master's program that has a specialization in it. And there are probably other variations on this depending on the school and the type of program. There are also other degrees and certifications that are very similar to medical family therapy. And the first of those that I found is integrated behavioral health care. And it seems like some people use medical family therapy and integrative behavioral health care interchangeably, but it sounds kind of vague, but basically it seems like it's just integrating healthcare with different modalities and different practitioners, different professionals, just to provide holistic care. There's also, of course, the field of psycho-oncology, and many major universities, UCLA, University of Boulder, Florida, Stanford, etc., they have PhD programs, PsyD programs, or fellowships in psycho-oncology and other specific training programs. And there's also the field of health psychology that you can get a master's in, a PhD, a PsyD, probably some sort of certifications as well. And the difference between this and psycho-oncology is that it seems like health psychology, instead of just focusing on cancer, it focuses on more chronic illnesses or broadly illnesses and how just illness itself affects mental health and people's psyche. As with many degrees or post-degree certificates, the length of time for a medical family therapy degree or certification varies. I am seeing anywhere from 13 months to 64 months, depending on the education choice and the school. And I am also seeing that there are in-person, virtual, and hybrid options for a medical family therapy degree or certification. Courses in medical family therapy programs include courses on grief and death, trauma-informed care, pharmacology, and you usually have to do a practicum year. And there's, of course, many more courses and interesting classes that you can take. So, why is medical family therapy important? Well, as I mentioned previously, a huge portion of the US population is affected by some sort of medical challenge. As of 2022, there's an estimated 18.1 million cancer survivors in the US. About 2 million will be diagnosed each year, and over 700,000 deaths. Similarly, 133 million people are estimated to have some sort of chronic health condition in the US. So let's estimate that every individual in the US, on average, has about 10 to 15 close family or friends in their inner circle. That means that billions of people in the nation are affected by some form of health issue. And no matter the severity, duration, or treatment, since all of them affect the body, they affect the mind too. And your mind deserves care and support when going through a physical trauma or a physical ailment on the body. So to finish out this episode and to really hone in on the importance of medical family therapy and focusing on medical specialization in therapy, I am going to share with you some quotes that were shared to me by clients and were shared by clients of other colleagues over the past few years. And these clients are all affected by cancer or some form of chronic illness. Quote, "You saw me after first being diagnosed and having my hair shaved off, and you've been a comfort to me ever since throughout the cancer journey. You were there in the most difficult time in my life where I needed support and understanding. I'm so grateful to have you as part of my team and fight. Your support and understanding gives me the motivation to continue to get stronger. I love having a therapist to talk to who is well versed in medical terms and understands the mental status of a sick person." So to all mental health professionals out there, let's strengthen our knowledge and expertise to help those impacted by illness by learning about medical family therapy or even just learning more about the patient experience and mental impact of having a physical health issue. Some books that are really life-changing to show the mind-body connection in the face of illness is Between Two Kingdoms by Suleika Jaouad and The Invisible Kingdom by Meghan O'Rourke. I will link those in the episode details. Thank you for listening to Just Therapist Things, where we talk all things therapy. I'll talk to you soon.